All right, so today we're talking about the use of mobile clinics because they can be so helpful to those who don't always have access to quality health care nearby. Cone Health uses them all across the Triad, including right here in Greensboro. The Clinic on Wheels stopped at Freeman Mill Square. And that's where WFMY News 2's Sydney Moore met a man who says the mobile has greatly improved his health.
Our parks and recreation system is great.
Barry Jones enjoys living in Greensboro. It's where he's lived all his life.
But I actually live in the southeast part of town now.
As a native, he's watched the city evolve over the years in good and challenging ways, specifically where he resides near Freeman Mill Square.
When I was a kid, this was a very self-sufficient African-American community, but through revitalization, so to speak, that was taken away. We saw the mall come in, so that moved a lot of the businesses away from this community. And in places that drugs and violence came in.
He feels like the area became a desert for many things like food and access to health care.
I've noticed a lack, but I've noticed an effort to address it. But I think one of the problems is our community, we don't have health insurance.
Jones has chronic high blood pressure. At one point in his life, it was considered critical.
I did not have primary care. So therefore, if you don't have primary care, you can't get a 30-day prescription renewed time after time like you need to do with chronic disease.
In urgent need for care, he was referred to visit Cone Health's mobile clinic that was parked right near his home.
My lifesaver. When I came here, that was my goal, was to get a healthcare provider to write the prescriptions.
And he did just that.
So just need you to fill out the registration form.
Well, it's a walk-up only. They may need to have their blood pressure medication bridged until they get to see their doctor, or they may just have not seen anybody for their health care in several years.
Physician assistant Carrie Mayers helped assist Jones. She says scheduling to see a primary doctor can be difficult due to an influx of patients. Mobile clinics help alleviate that issue.
We do get to spend more time with a patient based on how many people are waiting to be seen.
I had heart exams through other providers that did not find what she found just with a stethoscope. So, you know, that really threw me for a loop right there, and it got the ball rolling on me trying to get into better health.
Thanks to a correct diagnosis, medication to manage the disease, and easy access,
I call this my public service announcement to my community.
Jones uses his voice to encourage others to take advantage of mobile clinics that help steer his health in the right direction. In Guilford County, Sydney Moore, WFMY News 2.
Well, Barry Jones, who you just saw the story about, is now on the road to having better health. Well, who can use the mobile medicine services? What all is offered there? To answer those questions and more is Dr. Olu Jegede. He's Vice President of Clinical Care, Health Equity for Cone Health. All right, so when we talk about this mobile medicine program, Doctor, what exactly are we talking about? What's available?
Good evening, and thank you for having me. So Cone Health the mobile medicine program is one of the ways Cone Health is keeping our brand promise of we are right here with you. So we take care to our people in the community through the mobile medicine program. Right now we have about 3 units. One is the mobile medicine, which is really clinic on wheels. And then we have the mobile screening van and the cancer screening, which is mobile mammography for breast cancer.
Okay, so let's kind of like go through each one of them because it's like a doctor's office that's on wheels. The specific services, starting with the Cone Health mobile medicine unit. What can you get done on that unit?
Oh yeah, thank you for asking. So the mobile medicine itself is like the clinic that you go to, like you go to your doctor's office. We provide all care, including acute care and chronic disease management. The acute care could be like flu, sore throat, or even common cold. And then the chronic disease are those high blood pressure, high blood sugar, cholesterol, asthma, or COPD. So you come to the clinic, you get checked like you will in your doctor's office.
Gotcha.
And we see patients from age 6 and above, and all ages, that is about 6 years, all the things that we screen them for, will they come and get care for the chronic disease that they have.
Okay, so that is kind of like your primary care kind of mobile unit kind of thing. Now you have a screening unit. So what's offered on that and who can be screened and for what?
Yeah, so the screening unit is really very important because our goal is to go upstream and make sure that people they know exactly what they may have. Um, for example, statistics let us know that people between the ages of 18 and 44 who have high blood pressure, 1 in 5 actually know they have high blood pressure. So we want to make sure that people are getting screened for high blood pressure, for blood pressure, blood sugar, making sure that we are connecting them to care and making sure that people are aware of even things to prevent. Say you have pre-diabetes, we want to make sure you don't get to the level of diabetes. So we can only do that by screening. And when we screen you, we'll tell you your result, we connect you to a primary care. And then from there, you get the care that you need. And this is also from everyone from 6 and above.
Gotcha. I can't imagine only 1 in 5 know that they actually have high blood pressure. So you got a lot of people out there walking around not knowing that they should be doing something with their health.
Exactly. And you know, blood pressure, when you have high blood pressure, there is usually no symptoms until complication has arrived. When I see patients in my clinic, it's very unfortunate that, you know, a lot of the time I'm seeing them for the first time after a life-changing event has happened, like stroke, like heart attack, like maybe now they're on their way to dialysis. We really don't want that to happen. So we want to screen everyone and point their attention to those chronic diseases that sneak into us in our 40s and 50s and may cause damage before we know it.
So the next vehicle that we want to talk about is the Cancer Center Mobile Screening Unit. So what types of screening does it offer and what are the qualifications for people to be able to use that?
Yeah, I'm glad you asked because a lot of people think because it is mobile mammography that it's only for breast cancer. But we're lucky to have partnered with our breast center and we can use a DEXA room to do two things. One is the mammogram for women age 50 and above, and also DEXA screen, which is bone scan. As you age, we also need that done. Now, if you are a man wondering what can you do on this unit, you can actually go there also and get screened for prostate cancer or for colon cancer. And also we do cervical cancer screening for all our women from from age 21 and above, depending on their activities. So to be able to use this unit, we will need at least 14 people registered for mammogram, and then that is the way we can take the unit to any event.
Okay, and so people may be concerned about costs, not having insurance. How does all of that work with the mobile medicine program?
So we see everyone regardless of their ability to pay. We have home discount, we have financial assistance. If you don't have insurance, we first maybe try to qualify you for Medicaid now that there's expansion. But if that doesn't work, we still have a way of making sure that we care for you. So through our home discount, you will go, probably not even have to pay anything. It also depends on federal poverty level, that we use as a scale. But a lot of our patients who have no insurance get care just like any other person. So you don't have to worry about cost. All you need to do, you don't need an appointment. Just walk up to the unit and we will see you.
I love that. You don't even need an appointment because that too can sometimes be a barrier. So you don't even need to do that.
You do not need an appointment, although we will see you as you come. So it's first come, first serve.
Right, okay. So what happens though if you find out, you go to the mobile unit, you find out you need follow-up care or you need to see a specialist? I mean, that's the whole beauty of the mobile unit, right? It makes the access easy. But if you need follow-up or a specialist, that may be a little bit more difficult.
Yeah, that is really very important. So we always discuss next step in their care with them when they come to us. And a lot of people, like you rightly said, will need specialty care after we've seen them for primary care. And we have robust specialists in our medical group that are willing and able to see the patients. If the appointment is going to take longer time, we have a way of bridging them on the unit, by doing some what we call consult, getting some advice from the specialist. What can the patient do in between before they come to see them? So on the unit, we have referral system to connect our patients to specialists as well.
Okay. COVID changed our life in so many ways. I mean, we do all kinds of interviews through Zoom now. We never used to do that before. It also kind of got us in the rhythm of not going to like regular doctor's appointments and things, and that kind of stuff fell by the wayside. As we're getting on track, can we talk about just a little bit like why that is so important?
It is so important, like we discussed earlier, a lot of things sneaking. You don't want things sneaking in on you. The screenings are so important. Colon cancer screening, prostate cancer screening, breast cancer screening, all those things, when they are caught early, we have technological advancement now that people can actually be cured. You know, when we catch them early, they can be cured. When you discover you have high blood pressure or high blood sugar, and you start to work on it on time, you can live as long as you want. So all we want is give everyone the fair and just opportunity to live as healthy and as long as possible.
All right, we just have about like 30 seconds left. If they need to know about the mobile medicine program and where the next stops will be, how do they find that out?
We are very active in the community. We go to almost all events that are available and that we know. So at churches, at the mall, YMCA, we are there. But more importantly, we publish the schedule on the website. So it's conehealth.com/mobilehealth. You can find all the information you want and where the bus will be the next hour.
Great. Okay, so conehealth.com/mobilehealth. Easy enough.